Reed here. Today, we're going to have a discussion on Prolixin Decanoate injection. Prolixin is a typical antipsychotic, and Decanoate is a form that we give on a monthly injection. So today, we're going to talk about the Prolixin Decanoate injection. Um, let's see. So today, we're going to talk about so why would we want to use a Decanoate injection? Well, it's a monthly shot. Now, every time you administer medications to a patient, you always have to consider whether or not the plan you come up with is simple enough for them to comply with it. If it's too complicated, like taking 4 times a day, they may miss a dose or two. So typically, there's a rule. You know, Usually you only want to prescribe it as less frequently as possible. So preferably once a day as opposed to 4 times a day, right? In addition, even once a day dosing medications becomes a burden for most people to maintain going on moving forward. So at times we have to give them a monthly shot. And um, Prolixin is one of the monthly injections that I use all the time. And I've had a lot of success with it. It's been very helpful. Now, remember, Prolixin is a typical antipsychotic. Now, remember, the typical antipsychotics are the older ones, sort of like the first generational antipsychotics. And the thing that's common with the typical antipsychotics is they primarily target the D2 receptor, right? And then the atypical antipsychotics, or so known as the second generational, like Risperdal, Seroquel, Abilify, Geodon, all of those target the D2 receptor, but they also target D1 receptors and also target the other receptors like serotonin, norepinephrine, acetylcholine, histamine receptors. And so the different atypical antipsychotics, they bind the different combination of receptors with different affinities. So looking at the range of options that you'll receive with atypical antipsychotics, you can sort of select, let's say, the perfect medication to target what you're trying to achieve. I try to select it like that. I look at what's happening with the networks, try to see what regulates the networks, and then look at my tools. I kind of look at and many times I have to look this up in order to get it right. I have to look it up. Hold on 1 second. Sorry about that, guys. Okay, we're at Prolixin Decanoate injections. Okay, so let's see here. Okay, all right, let's see here. Okay, so let me go here. Okay, Explain Prolixin Decanoate injection. Focusing on the mechanism of action. Prolixin Decanoate. Fluphenazine. Prolixin is fluphenazine decanoate. A long-acting injectable form of fluphenazine. A first generation or typical antipsychotic. Let me get it on the stage. Let me start off on the stage here. Okay, so here's our overview of Prolixin Decanoate. And I put explain Prolixin Decanoate and injections, focusing on the mechanism of action. Okay, the overview of Prolixin Decanoate injections. Prolixin Decanoate, also known as fluphenazine. Okay, it's a long-acting injectable form of fluphenazine, a first generational or typical antipsychotics. Remember, primarily the D2 receptor, right? Primarily from the phenothiazine class. Is primarily used for the maintenance of chronic psychotic disorders such as schizophrenia in patients who may have difficulty adhering to daily oral medications. Okay, so if we have patients where it's been effective and there's compliance issues, then you can consider the injection. It's administered intramuscularly or subcutaneously every 2 to 4 weeks. The decanoate ester allows for slow release of the active drug. Remember when we looked at Haldol decanoate yesterday? Same thing. It's the decanoate ester. When it attaches to the molecule, it becomes lipophilic. And you inject it in the deep muscle, then it can move into the fatty compartment, right? But after the bond is hydrolyzed, it's no longer lipophilic, it's hydrophilic. And then the molecule can dissolve in the blood. Now it becomes active. Same release. Allows for slow release of the drug, providing sustained therapeutic effects over an extended period, typically up to 4 weeks. The depot injection helps improve compliance and reduces the risk of relapse in the long term. Great. Here we are here. Mechanism of action. The precise mechanism of action which Prolixin Decanoate exerts its antipsychotic effects is not fully known, but it is primarily attributed to the potent blockade of the D2 receptor in the mesolimbic and mesocortical pathways of the brain. See, it's interesting how this AI sort of put together this content here because the mechanism is known, right? There may be an older source that is pulling from. The dopamine blockade is thought to normalize dopaminergic hyperactivity, which is implicated in the positive symptom psychosis, such as hallucinations, delusions, and disorganized behavior. Right? And we went through that, the typical antipsychotics, we went through that. Here, key aspects of the mechanisms. Dopamine receptor antagonism, right? Fluphenazine decanoate binds with high affinity to D2 receptors, inhibiting the binding of dopamine, which is the exogenous neurotransmitter. This reduces excessive dopaminergic signaling in the limbic system, alleviating psychotic symptoms. It also has some activities at other dopamine receptors, D1 receptors, and to a lesser extent, there's the serotonin receptor, though its effects are potentially dopaminergic compared to the antipsychotics, the atypical antipsychotics. And we reviewed that. Broader neurotransmitter effects. As a phenothiazine, it inhibits additional antagonisms. Okay, it inhibits histamine receptors, alpha adrenergic receptor. Look, the histamine receptors, that's sedation. The alpha adrenergic receptors, orthostatic hypotension. Muscarinic receptors, causing acetylcholinergic side effects like dry mouth. These off-target effects contribute to the drug side effect profile, but are not essential to its antipsychotic effects. Pharmacokinetics in relation to mechanisms. Upon injection, the decanoate ester. Okay, pharmacokinetics in relation to the mechanisms. Okay. Upon injection, the decanoate ester is hydrolyzed by the plasma esterases to release free fluphenazine gradually. The peak plasma levels occur between 24 to 74 hours post-injection, with therapeutic effects on psychotic symptoms becoming noticeable within 48 to 96 hours. The prolonged duration, half-time 7 to 10 days for the ester, but up to 14 to 21 days for the active effects ensures consistent receptor occupancy, maintaining dopamine blockade without daily dosing. That is very interesting. That's a very effective strategy. Wow. So, yeah, so the peak plasma levels occur between 24 and 72 hours post injection. Okay. The therapeutic effect on psychotic symptoms becoming noticeable within 48 to 96 hours. You start blocking all of those receptors on that mesocortical and mesolimbic pathway, and it slows the pathway down. The prolonged duration, meaning half-life of 7 to 10 days. So the ester has a half-life of 7 to 10 days, right? But up to 14 to 21 days for active effects. This ensures consistent receptor occupancy. You know, this is really interesting. You want receptor occupancy when you deal with these type of things. It's interesting describing it as receptor occupancy as a way to block the receptors and decrease the activity in the mesocortical and mesolimbic pathway. Very interesting strategy. I use these medications all the time. This mechanism is supported by clinical and pharmacological studies. Hold on one second. Okay, this mechanism is supported by clinical and pharmacological studies, which show fluphenazine efficacy is comparable to other antipsychotics like chlorpromazine through its high potency, approximately 50 to 100% times more potent at the D2 receptor. Wow. Wow. However, the exact therapeutic pathway remains under investigation as dopamine blockades alone does not fully explain all risk benefits such as EPS from the D2. Yeah, I think it does. I think it does. So that's Prolixin. Let me just go through the drug Prolixin real quick, just to give you sort of an overview of it, since we're going to Prolixin Decanoate. Okay, Prolixin is a brand name. This is fluphenazine, first generational, typical antipsychotic medication belonging to the phenothiazine, right? It is used primarily to manage psychotic disorders, right? Because it blocks dopamine, such as schizophrenia and occasionally other conditions like severe agitation and bipolar disorder with psychotic features. Fluphenazine is available in 2 main oral tablets and long-acting injection, right? Okay. Key indication: treatment of schizophrenia and other psychotic disorders due to control symptoms such as hallucination, delusion, and disorganization. Remember positive symptoms, right? Administration: oral 1 to 4 times a day. Remember, that's tough, 4 times a day. You get the injectable, that is once every 2 to 4 weeks, okay? Pharmacological class: the phenothiazine antipsychotics with piperazine structure. Piperazine structure is known for high potency. The mechanism action: fluphenazine primarily results its therapeutic effect is achieved through antagonism of the postsynaptic D2 receptor in the brain. Antagonism of the postsynaptic D2 receptor in the brain. The brain, particularly the mesolimbic pathway, which is associated with psychotic symptoms. By blocking dopamine binding, it reduces excessive dopaminergic activity through the contribution through to thought to contribute to positive symptoms of psychosis, such as hallucinations and delusions. There's a key aspect. There's the dopamine D2 receptor blockade, right? High affinity binding to D2 receptors and the mesolimbic and mesocortical pathway reduces hyperactivity linked to psychosis. It also affects D2 receptors in the nigrostriatal pathway, which can lead to EPS, like Parkinson's disease. Remember, positive symptoms when the mesocortical is hyperactive. Drug-seeking reward system is when the mesolimbic is hyperactive, and when this nigrostriatal pathway is hyperactive, you get the Parkinsonian type disease because it starts blocking, blocking the receptors in that area. Now the motor functioning don't work well because remember, in the basal ganglia is primarily dopaminergic neurons too. Remember. Additional receptor. Fluphenazine has a secondary effect on other receptors, contributing to its side effects profile: histamine, alpha-adrenergic, muscarinic, serotonergic. Yeah. Efficacy. Fluphenazine is highly effective for positive symptoms of schizophrenia, but less effective for negative symptoms, right? Because we're hitting that D2 receptor primarily. Social withdrawal, apathy. Now these are the negative symptoms when the network is hypoactive, right? It is comparable to other typical antipsychotics like Haldol, but is 50 to 100 times more potent than chlorpromazine. Thorazine. Let me look at that. I'm gonna look that up. Side effects, EPS, because you're blocking these nigrostriatal. It's called nigrostriatal because when you look on these samples, the highly dopaminergic areas are the dark areas, right? And so these clusters of dopaminergic neurons, and you're blocking these neurons in the nigrostriatal pathway by blocking the receptors. Of course, it's going to have an impact on movement. Right? And so muscle stiffness, muscle tighten dystonia, akathisia, the constant sense of you can't get comfortable, the constant sense of moving, tardive dyskinesia, like the long-term reversible side effects of antipsychotic medications. Anticholinergic, because it hits the histamine receptors, right? Dry mouth, constipation, blurred vision, right? I'm sorry, the acetylcholine, anticholinergic acetylcholine. So acetylcholine, hyperactive acetylcholine means all the fluids are runny nose, runny nose, sweating, diarrhea, things like that. But anticholinergic means everything's dry mouth, dry eyes, constipation. So it blocks the cholinergic receptors, and you get the cholinergic blockade, and that causes that. The next thing here is we're talking about sedation. That's when we block the histamine receptors. You have cardiovascular. Remember, if you block the alpha adrenergic receptors with these, you can get hypotension or you can get the prolonged QTc interval. And then NMS is very rare, but that's a very severe side effects. We'll go through NMS later. Contraindication, you don't want to give it to it if they're sensitive to phenothiazine. CNS depression, because you don't want to be blocking more dopamine in depression, or coma or significant heart disease. Okay, drug interactions, I'm sure with CNS depressants such as alcohol and opiates, interacts with anticholinergic may alter efficacy in certain antipsychotics. Advantages to Prolixin, the limitation, inclusion. I think that's all I have for now. It's a pleasure to do this with you. That's my discussion on Prolixin Decanoate. Remember, if you're having difficulty with compliance, then you can switch over to a long-acting injection. And Prolixin is 50 to 100 times stronger than Thorazine. I use Thorazine a lot. I didn't realize that point. But it's a pleasure. Read out. Take care, guys. Until next time. Ciao.